the last video, we talked about glycemic index and glycemic load in the foods we eat and the factors that affects it. In this video, we'll talk more about carbohydrates and also when we make food recommendations, on what basis do we make these recommendations and how an individual person can make food choices based on these recommendations. I am Bharati Raju. I am an endocrinologist working in United States. Last week, we talked about the blood sugar changes that happens based on the type and composition of the carbohydrates, food processing, cooking methods, timing of the meal, activity that happens around the meal composition, and factors like those. Because of the complexities that surrounds carbohydrates and blood sugars, many of us opt to eat keto diet, paleo diet, or some form of low carbohydrate diet. In short term, these diets do give weight loss and blood sugar control, but we still don't have long-term health data on these diets. That's why, in general, medical community do not recommend one macronutrient over the other. When we say research studies shows this food is good for you or that particular macronutrient is good for you, we need to understand how these research studies are done. In any research study in medicine, we first try to ask the question that needs an answer, then we decide on the study population, the research methods, and the results we are trying to measure, any inherent bias, and finally we come to a conclusion. Once a conclusion is made, that research paper is presented to the peers or the experts in the field, and they read the research paper and confirm that the methodology and the results are valid. Once they validate the research, this research paper gets published in a medical journal. Once it gets published in a medical journal, there are other researchers who read it and they try to replicate the research study and try to get the consistent results. Once the results have been replicated, a certain recommendations are made to patients or general public. So what studies have showed is that eating a more balanced meal is more beneficial than choosing one macronutrient over another. In general, patients with diabetes comes to see us every 3 to 6 months. When they come to see us, we provide the research-based food recommendations and we measure their blood sugars or A1C the next time when they come to see us for a follow-up. In 2006, the company Dexcom received an approval for glucose sensor. These glucose sensors, when attached to a patient, were able to give blood glucose every 5 minutes. When we looked at these reports, we were able to better understand the relationship between blood sugars and an individual patient's lifestyle. Most of the recommendations that I provide is from the knowledge that we gained from these reports. This is a Dexcom report of a patient with diabetes. You see, the blood sugar is measured every 5 minutes. And this is the blood sugar that's made by the body. And this is after a morning meal. This is an afternoon meal. And that's an evening meal. The base blood sugar is always in the 180s. And whenever the patient eats more, the blood sugar goes up. And when he eats more, it goes up even up to 200s. This is the report of a patient who supposedly doesn't have diabetes. So their overnight blood sugar is in the 90s and 100s. And whenever they eat, their blood sugar goes up and comes back down within an hour or two. Goes up, comes back down. And this is another day for the same person. That's the sugar that the body makes, and that's the sugar that goes up when they eat. This is a report of a patient whose diabetes is not under control. If you see, this is the normal ranges that it's supposed to be, and the patient's blood sugar is off the chart. It's in the 300s, and it comes back down. That is the sugar that the body makes, and whenever he or she eats, the blood sugar goes very high, and then it comes back down most likely with insulin. The whole point of that report is to make people understand whatever changes that they make, whether it's in diet, exercise, or medications, the blood sugar response varies widely based on their own biology. So it's very important to make those changes and measure their blood sugars or HbA1c to find out if those changes has made an impact in their general well-being. Next week we'll continue more on the topic diet and diabetes. If you like the video, please share it, and if you'd like to get notification about our next video, please subscribe to our channel. Thank you very much. Take care.